Hello everyone. This video recording will cover chapter 5, and we will talk today about gerontological nursing and horse health promotion that relates to this population. As we have already covered this, gerontological nursing is a specialty, and the nurses working in this field are dealing with population who is 65 years and older to address unique needs related to this population, and they practice guided by evidence-based guidelines. Of course, it's related health promotion interventions, and the role of nurses working in this field is promoting health and wellness of this population and prevent functional decline, health and functional decline. First of all, let's discuss the difference between gerontology and geriatrics. Gerontology is the study of aging and older adults. It focuses on healthy and successful aging, while geriatrics focuses on medical problems of this population. This is the difference. However, recently the focus will shift from curing to caring. Not all conditions can be cured. Majority not, but can be managed. Geriatric nursing was not considered until 1960s. American Nursing Association created a document and published a document that called Gerontological Nurses Scope and Standards. Responsibilities of gerontological nurses include, besides health promotion, work on evidence-based information. They participate in studies and research and work in collaboration with other specialties, and of course they are leaders in their field. Talking again about health, wellness and health promotion, health is individual experience of well-being, harmony and unity. What do you think? Can a person with multiple chronic conditions still be considered healthy? Think about this. As long as an individual can function at a certain level, meet his or her needs, he or she might identify himself as in good health. There are some individuals that have disabilities from a young age, even from the childhood, and they still consider themselves healthy as long as they don't decline and don't have functional deficits. Wellness is considered as the ability of older adults to function to their highest potential and highest capacity. Being aware about all of this is essential for prevention of chronic conditions and reducing mortality and improving quality of life of this population. Let's talk about health promotional programs and interventions. Interventions can be on individual, groups, and community levels. In majority of cases, you have already faced this in clinical setting when you took care about this population, of this client. But let's discuss each activity individually. For example, physical activity. Is it beneficial for health promotion of older adults? Yes, definitely, as long as the person is physically active. And under physical activity, we think not only about jogging or weightlifting or swimming. Physical activity considers also walking exercises or whatever a person can achieve and tolerate to the degree of his or her functional capability. Definitely optimal nutrition. In majority of cases, especially if you work in clinical settings such as inpatient setting or a skilled nursing facility, you may face a situation when an older adult might not consume food as you would like him or her to eat, not 100%. And in these cases, many things are responsible. It can be their taste was changed, multiple medications received, or maybe just food not tasty, especially if the person is on no added salt diet. All this can affect milk consumption. In this case, it's good to deal with the registered dietitian who is at great help for optimal nutrition consideration. Recommended screening and preventative services. Under preventative services, of course, we think about immunizations that are appropriate for certain adults' age, and CDC is a good source of recommended immunization. In terms of recommended screening, besides yearly physical recommended screening also includes hearing acuity check for cerebral function, check for visual acuity. All of these are included in recommended screening. After a certain age, we may not screen individuals, for example, for the breast cancer, we don't do yearly mammogram after a certain age, like 75, 76 years old. Next is stress reduction method. Again, unfortunately, you're not exposed to activities in adult daycare centers, but exercise and group activities that they do are very helpful for stress reduction. Healthy relationship. Even though in old age, our intention is to promote healthy relationship. If a person is hospitalized, his or her wife or husband visits, and you have to do all possible to make sure that they can communicate, visit, or to see each other. I have recently a very related incident. A family member told me that one of my patients who right now was admitted to a skilled nursing facility for a short-term period, they were promised that they will see the patients through FaceTime. And so far they didn't do this. So I called the facility, I spoke with nurses, and I called a social worker, and I asked to give this opportunity for the family to see their loved one. So to promote healthy relationship. Also, self-wellness actions and spiritual growth. Under spiritual growth, what I saw in my practice, religious individuals presenting a certain religion visited patients, especially during high holidays celebrations, and they help patients to say a prayer, and it's also was very important for these individuals. Types of health promotion interventions. We discussed a little bit about screening programs. Under risk reduction interventions, we think about prevention, like such as fall prevention and prevention of cognitive decline. Again, in adult daycare centers, they do different activities, depends on the person's level of functioning and cognition, different activities to promote appropriate cognition and prevent the decline. Also, environmental medications, you're very knowledgeable, as I know about this, how to do assessment of the environment within one's household partner. And of course, health education. You have to remember that health education of elderly people is supposed to be done on their level, and you guys should avoid medical terminology. Also, medical terminology right now is a part of your language. You should watch what you're talking and speak and explain, so your client will be able to comprehend and understand what is taught. Otherwise, health education is not effective. Also, there is issue with memory problems, that whatever you taught might be not saved until the patient will go, for example, from the appointment to back home. So to deal with this issue, when I saw patients within the office ordered multiple handouts in different conditions, and every time when I saw a patient with a certain condition, like AFib or congestive heart failure, or have hypertension, And if I had a handout, I used to give it to a patient for a review at home. Problem was with language barrier and those who didn't speak English, these handouts were not very effective. So there is some pros and cons of printed material. Resources for health promotion. You can look for any publication and web-based information. Be careful when you do online research. Look for credible information from national guidelines, professional organizations. Primarily, avoid using websites that end on .com because it's commercial and everybody can write and it's unreliable information. Promotion of physical activity as a nursing intervention for wellness. Remember that same for a younger individual, you recommend to do physical exercises during the day, at least 30 minutes or as tolerated. Sometimes the patient might do walking activities only for 10 minutes. It's okay just for the beginning. And finally, I would like to discuss health promotion intervention and trans-theoretical model is a very useful tool for teaching some individuals with, let's say, bad habits or those who require lifestyle changes. And it has, this model has 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. And let's go to the next slide that describes each stage in detail. For example, the first is pre-contemplation. At this point, an individual might not consider any change. Let's say, for example, we have a smoker who keeps smoking on a daily basis, and smoking is a habit that he or she doesn't even think to quit. However, you met this person, you provided education, and it was a starting point to go to the next stage, that is contemplation. At this point, it's like sitting on a fence. You're not ready to step inside over the fence, but you're ambivalent about a change. This individual might start thinking about what if I would stop smoking, for example. Preparation, some experience with change, like testing the water. In this stage, an individual might try to skip, for example, one time smoking, but at this point, it's not he or she are not ready for actual change. The actual change happens during the action stage, and when an individual might practice new behavior. At this stage, he or she might need help of healthcare providers, maybe some medications that are available to help quit smoking. Final stage is maintenance, or unfortunately might be a relapse. With maintenance, our goal is to continue a commitment to a new behavior, like smoking was stopped. A relapse is a resumption of old behaviors. I used to talk to former smokers, and I was told that initially it's very hard to withstand the smell of smoke if you stop smoking. But in case if you stopped and over some period of time, like in a month or so, this person no longer is irritated so bad with the nicotine smell. However, if this individual is under stress and somebody offers him or her a cigarette, a relapse can happen. This is the end of chapter